If your CCE exam is coming up soon, you don't want to miss this video. I'm going to share 4 proven techniques that I recommend to every candidate I coach that will significantly improve your chances of passing. These are simple but effective strategies you can practice and apply immediately that will make a noticeable difference to how composed and structured you come across on exam day. These aren't complicated, but they do work. Let's get started. Technique number 1, use your reading time wisely. You get 5 minutes of reading time before each station. Most candidates just use it to read the case, but that's not enough. You should be making structured notes during that time and fully utilizing that 5 minutes. I would be writing down things like history presenting complaint, problem list, key differentials, important investigation and examination findings, management in terms of non-farm and farm, and I would definitely highlight any red flags or urgent referrals that might be required. This already gives you a structured roadmap before the station even starts. And so when the station does start, you're not figuring out where to begin, you already know. That 5 minutes of preparation is crucial to setting up the next 15 minutes in the station. Technique number 2, pause before you speak. When the examiner asks a question, resist the urge to start talking immediately. In my exam, said something along the lines of, please give me a moment to collect my thoughts. I then talk 5 to 10 seconds to take a deep breath and organize my response. Then I would speak. From the first sentence, I was quite composed with the way that I would speak. And even though it sounds like a small technique, I found that it made a significant difference to coming across as confident to the examiner from the very get-go and leaving a good first impression. The third technique is if you get lost in a patient sim, summarize. Because there will be moments where you're midway through a consultation and you're not sure what to say next. Instead of just blanking out and going silent and stumbling and mumbling, I usually say something along the lines of, so Susan, just to make sure I've got this right, you said that you've been experiencing abdominal pain, it's been lasting for 7 days, the pain is central, it's radiating to your groin and you've been vomiting. Would you be able to confirm if I've got that correct? This does a couple of things. First, it buys you time to collect your thoughts. It demonstrates to the patient that you're actively listening, which is one of the competency domains the examiner is looking for. And it also reveals where the consultation needs to go next when you catch up to where you are in the consult. The fourth technique is ask ICE early. In the first few minutes of a patient's sim, ask about the patient's ideas, concerns, and expectations. This tells you where the consultation needs to go, and it prevents you from spending 10 minutes going down a clinical rabbit hole that the patient was never worried about. I actually spoke to a candidate after exam that they only found out with about, I think, 2 minutes to go in the exam, that the patient had several kilos of unexplained weight loss and they were concerned about cancer. And if they had asked those questions early on in the station, I'm quite confident it would have come out a lot earlier and they would have had a lot more time to focus on digging into that. If you found these techniques useful, you'll get a lot more out of them if you've also addressed the preparation fundamentals. I have 2 other videos I'd recommend. One on the most common failure patterns in the CCE, and one on how to structure your study. I'll link to both here in case you haven't seen them already. Finally, if you want realistic CCE cases to practice these techniques with, Fellow Academy offers a free trial with 8 cases written to the exact exam standard. Just click the link below to claim your free trial. Thanks for watching and good luck on exam day.